Thank you so much. And today really pleased and it's delighted to me because I'm here and I will present a very nice topic, inshallah. What I found that when you will be the last talker, so everything will be explained by the previous presenters. So my life will be very easy now, and I will just throw it up, like, because you understand everything now. So let us, without any further delay, let us start our presentation. So a community perspective of the impact of the U equal U. Okay, nothing to disclose, and my agenda today, I will touch some historical review, and then we will talk about U equal U impact from our local experience. However, we don't have that a lot of information and a lot of data from our experience, and then we will go to the real world data, and finally we will end with some messages. So let us start with the evolution of U equal U, and Bruce explained very nicely, and we will just have it again. All of us remember that in 1980 the first report of AIDS, because of when they found the PCB and the 5 previously healthy young men that ended with a diagnosis of AIDS and immune deficiency syndrome, and after that till 1987 when they introduced the zidovudine, they start as a monotherapy. Then in 1996, the highly active retroviral treatment initiated and started. In 2006, this is when first time the concept of treatment as a prevention introduced, and this the things that change the game actually. And 2 years after, in Swiss National AIDS Commission are the first to confirm that people living with HIV on effective treatment cannot sexually transmit HIV, and this is the first statement to prove that that theory behind. So in 2011, one landmark study explained by Dr. Jamila before, that's the HPTN 052. It's a clinical trial, and it's a very good trial that again demonstrates that treatment dramatically reduces the risk of HIV transmission in heterosex couple with a different HIV status. So 2 years after the Partner 1 study, the report of Partner 1 study, that's another landmark study, which a very nice study that explained clearly if you have a patient with HIV positive and he's virologically suppressed, undetectable, so he will not transmit the HIV to other. So in 2016, here the story start of U equal U pros. Huh? It's a 2006. What a big year. So in 2016, a group of people living with HIV collaborated with HIV researcher and launching the undetectable, untransmittable campaign. So this campaign is based on the groundswell evidence confirming that when treatment reduces HIV to undetectable level, it can't be sexually transmitted. And you know, I will quote now from Dr. Michael Bradley that we now have robust data. We now have the robust data to say with confidence. Now they are confident because of this data came from the Partner 1 study, and they confident to say that the people living with HIV who are not effective, who are on effective treatment, cannot pass the virus to other. And this is the Partner 1 result. It was almost 14 European countries, over than almost 1,200 couple, seroconcordant, that one HIV positive and the other HIV negative, without any use of condoms, and the transmission of HIV was 0. So the very same year, that 2016, New York City Department of Health became the world's first city and Health Department to endorse U equal U. What a big year. So the very next year that CDC confirms U equal U, people living with HIV who are virally suppressed have effectively no risk to transmit the HIV. The 2019, the official United States HIV treatment guidelines are updated to include U equal U, and here I will stress on what Dr. Jamila said on forcing or on the implementation of the U equal U in the guidelines. That will help a lot. And 2021, the UN start to talk about destigmatization by encouraging member states to leverage the U equal U as a stigma intervention tool. Finally, WHO woke up from the sleep and they implement and talk the U equal U and put it in the guidelines. They are late as usual, nothing surprising. So what about our local experience? We don't have official data, unfortunately, but we have experts. We have our experts. So in the physical health, if we talk about physical health, if our patient knows that, when we explain to our patient that if you are undetectable viral load, you will never transmit the disease to the other, they will do great. They become more active, like we are encouraging them, and they will continue the work, they will back to work, and many of them, they will even continue their studying and educations. Before, it was very bad news for them that, okay, I'm HIV positive, I will die within a year, like that, so everything is end with that information. After U equal U, everything changed, actually. Sexual health, yes, it's a very important piece of information. If you told your patient that U equal U, so they will do better sexually, and they will think about getting married with a seroconcordant that HIV negative, I mean, partner, and even they will planning to have a family and conceiving. So that's amazing. We didn't even hear that before, but after U equal U, everything is a change, actually. Mental health dramatically improved in terms of obsession, for example, depression, suicidal attempt, everything is improved. So overall health, that the community became more accepted. Yes, I'm sure about that. Still, there is some limitation, but it's better than before. They will accepting the idea of getting married from HIV positive partner. That's amazing. They will accepting that we will work with HIV positive colleague. That's amazing. They will live with HIV positive patient. That's wow, actually. So what's the role of social media? Dr. Nizar explained very, very nicely. And believe me, we are in Saudi Arabia, my colleagues and I, we are really found that the social media is the clue. The social media is the clue. If you are talking about a community, they are not reading a newspaper, so don't use newspaper. If you are dealing with a community using Facebook, for example, so use that Facebook. Look at the advertising. Where is the advertising, and follow that advertising. So social media, all of us know YouTube, Twitter, that the new social media, the new platforms like Snapchat, TikTok, all of this is amazing, amazing. And I noticed that from the Bruce lecture that he put almost everything in the down of his lecture, the Twitter, the Instagram, the Snapchat, everything is there. So we need to follow that path of the community. Social media, I will just talk a little bit about social media and the impact of social media. One of the videos I did with my colleague, 18 million visit for that video. 18 million. and it was about oral sex, only oral sex. So look at the gap when we live in a community who filled with a lot of religions thoughts, a lot of traditional thoughts, a lot of shame. Everything is there. If you send a message through social media, nobody will know that this guy saw this advertise or this piece of information, and they will improve and they will learn. They will do everything as you want. What about the stigma? Another big issue. A stigma is a stigma everywhere. It's I will quote from Dr. Abdullah Al-Hugail that when he told a stigma consists of three main points. The first one is the tradition, our tradition. The second one is our religion. The third one is the healthcare worker. And I will stress on the healthcare worker because they are very, very, very bad when you are dealing with a healthcare worker that's not believe in U equal U, not believe in the science, not believe in how the education will be a very good outcome to you and your patient and everybody. So stigma, we need to still we need to work on that, and I believe social media will help us a lot, and even I believe with education, maybe the most common word you hear today is the education. We need to educate everybody. So yes, we need to educate the colleagues, we need to educate the community, and really everybody. So what about the real world data? This is amazing study. I found that the information taken from the almost 25 countries. They estimated the percent of people living with HIV who ever discussed the U equal U with their main HIV care provider and measured the association with the health-related outcomes, evaluated whether the impact of U equal U message vary between those who heard it from their healthcare provider or from elsewhere. Yani they get the information from the healthcare provider or from social media, for example. And also the data were from the 25 countries, as I mentioned. What did they found? I don't know, where is the... Do we have pointer here? I don't know. This one? Yeah. So here, first the health indicators that if your patient happy about to know more about his viral status, for example, viral suppression, if we have this, for example, so completely unaware about U equal U, it's almost 56% only 50% of them, they are interesting to know about their viral load. So it's like, it's a message that they are desperate. But if they know about their U equal U, so they will be more active, and they will be more ambitious, that optimize, that they will do better and better. So what about the attitude and behavior? If they don't know about U equal U, they will behave very badly. But if they informed about U equal U, they will improve a lot in terms of behavior and attitude. What about spreading the HIV status with other? If they don't know, they will spread the data more because of they are like a desperate. But if they aware about the U equal U, they will trust their doctors more and more, and they will try to hide some informations that maybe they will thought that's not necessarily to know about others, because if we are treating ourselves, if we have an undetectable viral load, so we will do amazing. So no need to learn, to know about our status by other. So what about the not sharing the HIV status? Yes, they will convince if they aware about U equal U, and they will less convinced if they not aware about it. This is the groundbreaking research that showed clearly still one third of people living with HIV not aware about U equal U. So we need to work more and more. One third is not easy number. It's a significant number, and we need to work more about this. If they aware about U equal U from their healthcare practitioner, so it's almost more than 70% in treatment satisfaction and optimal adherence and self-reported virological control. And really by this, I will try now to give you some home messages. Yes, a respected percent of people living with HIV reported not to have discussion with their healthcare providers. As I mentioned before, it's almost one third. And people living with HIV who reported discuss with their HIV healthcare providers about the U equal U, more favorable health outcomes. So they will act better if they aware about U equal U from their healthcare provider. Some U equal U related information accessed from non-healthcare provider sources. So from wherever you get the U equal U, just get it. You need to know about it. No need to take it only from the healthcare provider. As Bruce mentioned that it's even in the metro advertisement. Everywhere, just sprayed it everywhere. So U equal U discussion between healthcare provider and patient should be considered in a standard of care guideline. We need to put it in all guidelines. We need to force our colleagues. Unfortunately, I'm saying forcing our colleagues, but we need to do it, and we need to put it in the guidelines. And by this, inshallah, we will reach for some improvement, inshallah. Thank you.